The best practice models, number 2. Now in the article that I just wrote recently, the number 2 model is the high volume model. Now this is a model that I personally practice. In my main clinic we saw 650 visits a week. I was able to duplicate that model and see through 5 practices 2,000 visits a week. Now this is a model that usually moves the main treating doctor out, up and above, and they become more of a figurehead. Now it doesn't start that way, but if you want to expand to multiple clinics, it does go that way. A high volume practice requires tons of new patients. In order to keep a high volume practice going, you need at least 10 to 20 new patients per week. You have to really know how to educate patients so they understand what you're doing and they're willing to pay. And then you have to, in today's model of high volume practice, you have to get the cash portions. You cannot leave those on the table. You have to make sure that you collect all the cash portions. Now the problem with some of the models that I see that are high volume is there's 2 ways to go about high volume. The first way, which is not one of the best practice models, is to keep that dollar per visit down. In other words, when you do the math of how much you make in a month and divide it by how many patients you see in a month, that number is below 30. 30 or below, you're in trouble. There's no way to pay for all the space, all the staff, and all the equipment, and all the help that you're going to need, and maintain a high volume practice, and still take money home if you keep that dollar per visit low. It's a high purpose clinic, but it doesn't help the doctor get anywhere financially. So if you're going to run a high volume practice, you need to make sure you understand insurance and that you understand how to collect cash. The difficult part of the high volume practice is it's overhead. There's a high overhead, and most high volume practices are operating at only 20% profit. The good point about high volume practice is it can easily add services to it because it has such volume. It can add other services beyond just the normal chiropractic type of care, and that could then supplement and increase the profitability. And that will even lead us into the third and my personal favorite practice type. Dr. Brent, over and out.